My name is Grace Bigelow. I am SiNERGE Project Community-Based Organization Outreach Coordinator and will be moderating today's session. With these presentations, we are hoping to provide the most current information on a variety of topics of particular interest to the sickle cell community. We hope to target a lay audience, thus having the content be accessible to all patients, family members, caregivers, and wider sickle cell community. Of course, we always welcome suggestions from you all on topics that you would like to learn about or people you'd particularly like to hear from. We're going to continue what was a very engaging and informative conversation around the issues faced by patients, providers, and those living, those in the lives of sickle cell disease patients in taking advantage of a highly effective treatment with hydroxyurea. This webinar will provide our audience with the personal narratives of two people living with sickle cell disease and utilizing hydroxyurea therapy, Mr. Charles Carter and Nikki Paul. Their stories will both inform and inspire us, hopefully galvanizing us all in our resolve to continue working towards improving lives of those living with sickle cell disease, as well as improving the relationships between those living with sickle cell disease, their families, and the healthcare system. Advance slide, please. Presenters will speak from an advanced slide, please. Both of our presenters will speak for about 10 to 15 minutes to be followed by a brief 5-minute Q&A period. Then we will open it to questions on both presentations as well as any other questions related to the topic. You submit your questions in writing in the space provided at the bottom of your computer screen, and I will read as many questions as we have time for to the presenters for their response. Quick, views expressed by presenters are their own and do not necessarily reflect the views or opinions of the William E. Proudfoot Sickle Cell Fund, SiNERGE Project, or associated parties. This webinar is for informational purposes only. Individuals seeking medical advice should always see a qualified health professional. And with that, I am happy at this moment to introduce Charles Carter. Born with sickle cell, Charles, early years, was in and out of the hospital. This affected both his schoolwork and social life. The physical limitations of sickle cell kept him from certain activities and sports. In the early 2000s, the Carter family met a woman dedicated to finding a cure for sickle cell disease, Ms. Gloria Rochester. Ms. Rochester was the first to introduce Charles to hydroxyurea. Since then, his health has improved dramatically. Since significant improvement in health, Charles has given over a dozen speeches about his life story and the benefits of using hydroxyurea. Charles Carter has only been sick twice after the daily regimen of hydroxyurea since 2001. Charles, we are so pleased to have you with us today.
Thank you, and thank you for that lovely introduction. My name is Charles Carter. I'm 19 years old and was diagnosed with sickle cell at birth. And those years, they were a struggle for me and my parents. I was sick all the time, coming in and out of the hospital, and it got so bad to a point where the doctors had to talk to my parents and that they need to expect the worst. Doctors didn't have hope for me at that age, and it was a real struggle for everybody in my family, not just including my parents. I had over 80 infusions out of the hospital, having numerous, getting my gallbladder and appendix removed. Things that were very, I would say, being in and out of the hospital that often. And with school, there were days that I missed a lot of assignments. Every toll on my grades, my social life. And I wasn't in the hospital. My parents and I were so kind of because at that anything could settle the crisis. When I was not in a hospital, I was very careful at that age because we didn't want to go right in. And around that time, it was just spending different holidays, Christmas, just laying on the bed. It was a real struggle. And not only was it an inconvenience, but it also was pretty expensive. Those hospital visits, it really, my parents credit, and all the hospital bills piling up is very overwhelming. And me at age, I had a sense of to mind and care for myself. And we recently decided to start a GoFundMe account for me to, with the trying to dig ourselves out of this massive hole that we have, the all the hospital bills and things that looking for to this my parents ran into a woman named Rochester. And from her, she's really been a blessing to our lives. Whenever my parents needed inspiration or advice with any arrangement, anything that my parents needed to hear at that time, and was the one that actually introduced me to hydroxyurea, into hydroxyurea. I thought it was very expensive for someone my age to be taking that medicine because it was only young adults. But again, my parents and I were looking to try something new because going in the hospital was clean for us. Decided to take that chance, and from that point on, hydro's been my life. I mean, my moved to hang out with friends, even join a couple of clubs, and I had a taste of being a and not only parents, they did a job in trying to academically, but they things that I couldn't when I was hospital. So I didn't a real blood, and like I find it to be amazing that something that could be so beneficial to somebody's life. Around years old, it suggested to my parents and I that I give a speech Hydroxyurea, and just kind of my life story with sickle cell. My parents' observations, but we had to take our chances. They saw that we decided to make it an ongoing to something we still do today. Not only do I give speeches, but I've a couple of articles for you with New York One. I've done an article with them, with Investors Advocacy Network. And any back to Ms. Rochester and the sickle cell community, I try to when I can. Ms. Rochester working on something right now with the those are the Type 2 incident. But Rochester are working on doing towards that. And like I can give back. Now, presently, I'm healthy. I took on a couple of extracurriculars such as boxing and basketball. They're healthy. I'm going to college at the University of Buffalo, and I'm still advocating for sickle cell here in Buffalo. Anything I can do to help others. And beautiful for me being healthy. My parents and I are still kind of getting myself out of that hole that we have with the new hospitals and trying to bring it back to where it was. And Bigelow was good enough to let me mention my GoFundMe account, which are for imagine if anybody wanted to donate, it would be greatly, greatly appreciated. And I Miss Bigelow and Miss Rochester for letting me speak to this webinar. I look to the conversation.
Thank you, Charles. Thank you so much. We do have some time for questions and answers. If people would like to type in questions, I don't see anything that's come in yet, but I do see we have a number of people on the call. And so I'll go to see if we have any questions coming in. It seems like one of the things that you have experienced is an increase in your energy level and your ability to increase your activity and to live a more full life. Is that correct?
Yes, absolutely.
Have you experienced what you might consider any serious side effects from the hydroxyurea therapy?
Well, No, I haven't experienced any serious side effects.
News.
It's yeah, no, I can't really say any serious side effects that I've had. It's been a great drug for me, and I find it very beneficial for those who any sickle cell who may be thinking about being on a hydroxyurea regimen. I would recommend it.
And ask, in terms of the actual taking of the medication and adhering to the taking it as directed, have you had any issues with that, or have you found a way to just incorporate that into your daily routine?
Again, I've been in medicine. I was 6 years old, so now it's kind of it's pretty dramatic.
Right.
So I know, need to take it, and just it's like automatic. So I know to do it right off the bat every day.
Mm-hmm. Mm-hmm. Well, we do have a question coming in from Jacqueline Davis, and she asks, how well do you do in the winter since you're attending the University of Buffalo? It's very cold up there, and that can set off an OFRF. I'm not quite sure what that means, sickle cell. And Jacqueline, it looks as if you might want to say a word or two. So let me go and go ahead and speak if you like. Would you like to just address the question regarding the coldness in Buffalo and how you deal with that?
Yeah, yeah, it's definitely a lot older in Buffalo and close. So I try to make sure I be warm, multiple layers. Sure that I'm monitoring my skin and taking.
Cold very seriously in terms of how you prepare.
Yeah.
Another question, was there anything that stands out to you in terms of what helped you make the decision to try hydroxyurea? Conversations with your providers, education, or tools that your provider had?
Well, it was mostly many of my providers, parents, and I. It was age. It was very experimental. But we had a talk with the doctors, and Mr. She was really the one that pushed me of taking hydroxyurea. And it was a chance that we decided to take because at that point, health was at its worst. So we really weigh out our options of taking the medicine.
Okay. I do have one other note here. One of the participants that's listening today would like to speak with you, Charles, and I'd like to maybe exchange your information after the webinar if that's appropriate and you're comfortable with that.
That's no problem.
Okay. And Davis, I am unmuting you just for a moment to be sure if that addressed your question. Getting a response. Do we have any other questions? I think we will move on to our next speaker. It is now my pleasure to introduce our next speaker, Nicola Paul. Nikki is a registered nurse with experience in direct patient care, research, and clinical administration. Living with sickle cell disease has shaped her personal and professional life in profound ways, including a passion for the care of others living with sickle cell disease from an early age. She honored to serve as the founding lead clinical nurse when Johns Hopkins Hospital opened its Sickle Cell Infusion Center in 2008. After a severe sickle cell crisis, Ms. Paul has used hydroxyurea since early 2015 with dramatic results. She's grateful to the hydroxyurea that hydroxyurea remains an option for individuals living with sickle cell disease. She's passionate about joining forces with others to continue her deep commitment to the extension of sickle cell disease awareness nationally and internationally. Welcome, Nikki.
Thank you, Juan. It's a pleasure to be here. I'm so happy and grateful that awareness for sickle cell disease continues to spread, and we continue the conversations that are so important to those caring for the disease and the treatment options. Unfortunately, as we know, hydroxyurea continues to be the only medication to treat sickle cell disease. My personal journey started really in Haiti. I was born in Haiti and diagnosed at birth. There, I really, as childhood, was frequently than I am now. My frequency of childhood, So I did have my first blood transfusion at the age of 5. My mother and my father both have sickle cell trait. So I just remember moving up to Silver Spring, Maryland at the age of 6 and undergoing many frequent hospital admissions at Jones Hospital in Washington, D.C. And I remember the colors on the lobby walls and just nurses that cared for me, and sometimes the care was adequate or inadequate. even early childhood, going into elementary school, where I had to go to the nurse's office to drink, fluid 3 times a day just to make sure my hydration was up. And this was better part of my elementary school years. Even just remembering having to sit out activities, to prevent sickle cell crises. So early childhood was really a difficult time for me with many inpatient admissions again. So moved to middle school and high school, I found that, my sickle cell crises decreased frequency, but my so I got, aged and really of others with sickle cell disease. I really was interested in research and wanted to make an impact on those. So go to college, I had a better time, I want to say, and really maintain my care. And I didn't have too many crises when I was going through my college years. When I was going my senior year, I was an RA, and I just remember having one really bad crisis, and I was, finishing up on my rounds and having to be hospitalized there. Moving on from college, I, studied nursing school was really impactful and really made and shaped my and the care. So I met up with sickle cell convention in 2007 in September, and I was able to then meet a nurse practitioner assistant who introduced me to the team here at the Hopkins Cell Infusion Center. There, I was able to practice as the lead nurse in the Sickle Cell Infusion Center and really undergo the mission and really help impact the care of those living with sickle cell disease. For me, as living on both sides of the caring as a nurse and also being a patient, I was able to really get a better appreciation for the research as far as my own journey with sickle cell. I really
you.
Okay.
Sorry.
No, that's quite all right. And for those with sickle cell disease, really made an impact on my life. As a patient myself, I started to really have the conversations with other patients saying, what can we do to improve your quality of life? And I had a patient in particular where we would really advocate for the use of hydroxyurea and conversations, and we made sure we went over labs and slideshows and things like that to really improve the education, and that made a great impact on their life. So personally, my journey, I had a really 2014 where I started to have more crises, and I actually had a sickle cell crisis with pneumonia. And I had a conversation with my hematologist, Dr. Molitano, who began the conversation of really how hydroxyurea will better help myself. And so we discussed it, and one of the great things that she was able to do for me is, actually show before and after slideshows of blood smear, which impacted my to the medication. At first, I was really, to be honest, reluctant, when we started to undergo the conversations about how hydroxyurea would help and really decrease the I would have and increase the oxygen carrying capacity. And we started to have the conversations and underwent a lot of the importance of in the side effects and the possible side effects of that medication. I started Hydroxyurea in 2015 of January, and it has greatly improved my energy level. I find that I'm able to be more active in comparison to my earlier childhood years. I continue to advocate for those who are living with the disease by important conversations that, yes, though sometimes you do have the reluctance to start the medication for side effects and whatever reasons, it's important to continue the use and, really sitting down and making sure that they understand what the importance is and how it can impact your life in a great way. So I continue to speak to those and really speak how it has improved the quality of my life and the mission that we set forth for the Sickle Cell Infusion Center. I just continue to, those to have, a knowledgeable hematologist and a knowledgeable primary care physician on their care team who will, help to guide the treatment plan as far as the hydroxyurea and really impact their life in a great way.
Nikki, have you said all you'd like to say for the moment?
Yes. Mm-hmm.
Thanks so much. Again, we'd like to open it up to questions, so please type in any questions that you might have. So, Nikki, one of the things, if I'm hearing, it sounds as if prior to a pretty horrific 2014, you had a relatively low number of crises. Is that correct?
That's correct, yeah.
Is there any indication as to why 2014 might have been such a difficult year?
I think it was a combination of work and travel, weather. It was a combination of a few things that really, deteriorated my health care. And so the pneumonia triggered the severe crisis that I had, which then, led conversations of how hydroxyurea could really improve my care personally.
And then I also wanted to ask, I recall when we were speaking a little bit earlier, and you did mention regarding being on both sides, both from the healthcare perspective and being a patient, and that one of the sort of advantages or was, being able to interpret some of your test results, lab results, et cetera. And I wondered if you might just talk about that a little bit in terms of what you actually saw in your results that gave you the ability to feel doing the right thing and being on this particular treatment.
Sure, to speak about that. So we're able to compare my hemoglobin and hematocrit levels before and after the start of hydroxyurea. Prior to, I was living, let's say, at about a 7.2, 7.5 hemoglobin, then translated over to hydroxyurea, increasing to about 10.4 average. So that really helped to increase my energy level. Again, seeing blood smears made a great impact on knowing how effective hydroxyurea was, because the first blood smear prior to the use of hydroxyurea approximately 20 to 25 sickled blood cells, whereas in comparison to 3 months later, there were 1 to 2 present sickled. So that made an impact to be able to visualize the effect that the hydroxyurea had, and the fact was feeling it physically just correlated along with being able to visualize it on the blood smear.
Mm-hmm.
Which really made an impact to all those who will start hydroxyurea as far as compliance, and really be able to compare the two and say, oh, I may not feel it or, the next, ready, but over time you definitely start to feel the progression in the quality and the increase in energy as you're able to get more oxygen in your red blood cells, and seeing that, with the blood smears really did make an impact, and being able to look into your own lab results to see how the positive effects are happening with the hydroxyurea.
Mm-hmm. Mm-hmm. Well, thank you very much. Now, Ms. Davis had wanted to speak, and I believe that she can now, if she would like to speak. Jack there? Jacqueline, are you there? Okay, I do have another question, and I will hopefully try with Ms. Davis again. And question, did they show you slides they have file, or does your doctor's office have the capability to show you your personal blood slides?
The ability to show you my personal blood slides. So when they take the CC, they actually have an option of including a sample. So the hematologist was able to upload, Dr. Molterno was able to upload my blood smear, my own personal sample, to show the difference in my outpatient visit, which really made an impact to see how the medication has been effective.
Mm-hmm. Mm-hmm.
Mm-hmm. That happened during my outpatient appointment, which was great to see.
Okay. And we have any other questions? We'll see if Ms. Davis is available to speak again. Ms. Davis, there? Give it a moment or two to see if we have any additional questions coming in.
Hello.
Is this Ms. Davis?
Yes. Can you hear me?
Yes, ma'am.
Okay. I've been here. I've been trying to get through.
We hear you now if you would like to speak.
Oh, okay. Yes. I just wanted to say that I understand. I have a son that has sick. So I have two sons, and my youngest is on a hydroxyurea since 2010, and he attended the Institute of Technology, which was also very cold. I had to go on because he had lung crises, and that was really the option that they gave him before they really went into any more intense that would help him with the crisis. So, I understand what they're going through. Absolutely. I've been with my son now back and forth to Rochester. He was in the hospital often. A lot of college students helped a lot. His teachers helped him a lot. He had to do an extra year. He graduated in 2012. He was supposed to graduate in 2011. So it was tough. It was tough, but it was definitely the right decision to do because my oldest son is also on apheresis. Okay, that's a whole other subject to talk about. He's been on that since 13. So I certainly understand hydroxyurea. It has helped him a lot. He does a lot of side effects. He's got to go with the medications that he does have to take, pain relief like morphine and all the medicines to help him get along. So it has been difficult, but the crisis has been a little less. He does still definitely get sick. This past February, he was sick quite a bit. He was in the hospital about on and off for 2 weeks. And that was hard, but he made it through, and he deals with a lot. He deals with a lot of the pain. he can handle it, and he needs help. He goes through treatment, but that's the problem. We need more treatment. We need, a center that he does go to is Montefiore in the Bronx, but we need more services. We need more resources. There's a lot more research that could help with sickle cell, especially adults.
Yes. Yes. Well, just thank you so very much for your comments, and we will. I'm going to go ahead and meet you again and just say that moving forward and expanding knowledge and access to hydroxyurea, also working to help improve the relationship between families, patients, and the healthcare they're providing, other healthcare systems, is what we're working towards. I did want to just ask if Ms. Rochester might want to say a word or two. And at the time, waiting to see if Ms. Rochester had any comments. Do we other questions? I'm not doesn't look like getting any additional questions at this time. A question for Charles. We have a very hard time getting teenagers to remember to take hydroxyurea every day. How do you manage as a teenager? Do you have any tips?
Yes, I would say, for one thing, there's a pill box that you can use. This is something that my mother bought me, where it has the 7 different days, so Sunday through Saturday. And we're very, visiting my grandparents in South Carolina, I always make sure to leave my pill box on my bed, so to take it every night. What I would recommend is to alarm. There are different phone alarms you can use, or alarms on the clock, or you can have one of your family members remind you. I know my mother does an excellent job at reminding me when I haven't taken medicine. So I'd say those 3 are the best options to go by.
I appreciate that, those suggestions. We will definitely be synthesizing all of what we've gathered today. And I do just want to say that if people are interested in more information or would like to continue the conversation, please feel free to be in touch with us. If you wanted to be in touch with the speakers, I'd be happy to talk to them about sharing contact information. And we certainly look forward and hope that you may have suggestions on next steps and how to get the word out and other information that could be useful. And again, we would like to share this information with everyone that was on the call today, as well as the wider community of those involved with those living with sickle cell disease. I do have a few. Just wanted to say that to the speakers and to the participant that this was a wealth of information. So we're grateful for everybody that was on the call, and we're very, very grateful to our speakers for sharing their personal stories. It's very, very generous of you to talk about these parts of your life. We're incredibly, as I said, grateful and look forward to moving forward. I'm going to just give everyone an opportunity, one more chance, if anybody has anything else to add. Let me just that I missed. Looks like that. Anybody with any final comments that they would like to write in? Otherwise, if not, we will just again thank everyone for their participation and really look forward to continuing the conversation and working to improve the options for those living with sickle cell disease and to supporting their families and working with healthcare providers. There doesn't seem to be any additional, or don't seem to be any additional comments. So again, thank you very much for being with us today. We will end this webinar. It is being recorded, so we will have follow-up emails to everyone thanking them for participating and a link to the recording, which please feel free to share. Again, any information, suggestions, people like us to reach out to, please don't hesitate to get in touch with me. And with that, we'll say goodbye. Thank you so much.